Broadcast is now starting. All attendees are in listen-only mode.
Hi, this is Sophia Asan from the Reproductive Health Supplies Coalition, and we have people now starting to join. Thank you for joining this webinar, and please just hold on. We'll get started in a couple of minutes. Hi, this is Sophia Asan from the Reproductive Health Supplies Coalition. We'll get started in just about a minute. Welcome to this webinar. This is Sophia Asan from the Reproductive Health Supplies Coalition, and I would like to welcome you to this webinar on behalf of the RHSC, the NERT Caucus, the New and Underused Reproductive Health Technologies Caucus, and namely our Safe Abortion Supplies work stream. We're pleased that you could join us today for this webinar, and wanted to just let you know administratively that you are all on listen-only mode, and you can feel free to type any questions that you have as you view the presentations into the question box on the right-hand side of your screen at any time. Following the presentations, there will be a Q&A portion to this webinar as time allows. So as we welcome you, As some of you may be aware, the co-chairs for this work stream are now Natalie Kapp of IPAS, and she has been joined by Florence Erb of the Concept Foundation. We're very pleased to have Florence joining Natalie, as Florence is currently a safe medical abortion officer at the Concept Foundation, where she's responsible for the South African region and is implementing activities in multiple countries for medical abortion supply availability. She is trilingual for English, Spanish, and French. And in terms of her education, she has a bachelor's in political science and a master's in international humanitarian action. So with this, I would like to turn things over to Florence to get us started.
So, hi everybody, and thank you very much for the introduction, Safia. And I'm very pleased and very proud to be joining all you today as the co-chair with Natalie Kapp for this webinar. So unfortunately, she was not able to join today, but so just to present a little bit this webinar, it is the 6th webinar of a series that has been initiated in September 2017. So it is a Safe Abortion Supplies Workstream webinar series. There was 2 webinars in 2018, and this is the 4th in 2019. So we have double efforts of voluntary work through these webinars, and it seems that it will be the last of 2019, but I hope we all look forward to have more webinars in 2020 and the years after. So today we will have Saskia Husken and Drew Overholt. I'm sorry if I'm deforming your names. So Saskia is working for Rutgers. She's the program manager for the She Makes Her Choice program, and she will start the presentation, and then she will be handing over to Drew Overholt that will follow as the second speaker, and he's the marketing director of DKT Women Care. So I leave the floor now to Saskia.
Thank you very much, Florence, and good afternoon and good morning to everyone. I would like to start by showing you our short animation video, which we just launched on the International Safe Abortion Day a few days ago, and I will take it forward after you've seen our animation video. So I hope my screen will collaborate. Here it comes.
Did you know that every 12 minutes a woman dies because she is denied a basic human right? The right to a safe abortion. The lives of more than 25 million women are put at risk when they are forced to have an unsafe abortion. This could be a woman you know. Our dream is to create a world where women stop dying unnecessarily, where women have this basic human right, and where women are free and supported to make a choice. A world with no more unsafe abortions. Rutgers and DKT International together developed a unique approach to make this dream a reality. To protect the lives of women and to prevent widespread maternal deaths, we start with preventing unintended pregnancies, which includes information about and access to contraceptives. And if a woman nevertheless becomes pregnant, she has the freedom to make a safe choice, and that choice includes her right to safe abortion care. Our unique approach focuses on 3 components: supply of quality products and care, demand and awareness raising, and creating supportive environments such as favorable policies and guidelines to enable access to contraceptives and safe abortion care. Starting in Kenya and Ethiopia, This approach must be implemented widely. A snowball effect will create opportunities for women in more than 80 countries to make an informed and safe choice. The Dutch postcode lottery supports Rutgers and DKT in making this dream come true, because she decides.
So I want to provide you with a little bit more background. I don't think I need to tell you about the devastating impacts of the global gag rule that already started to become visible in 2017. So when we started to think about a new program early 2018, that was at the time that our then Minister of Foreign Trade and Development Cooperation, Liliane Ploumen, took to the stage with a strong call for action when she announced that the Netherlands will commit to freedom of choice for women worldwide. That is when the She Decides movement won, and as a trusted expert partner, Rutgers, my organization, was requested by the ministry to be the torchbearer of She Decides. And when we started to dream big, we wanted to build on the She Decides initiative. We wanted to make an end to unsafe abortions and focus on one of those She Decides focus areas. And to realize this dream, we needed a partner that can bring scale. And this is when we approached DKT International. We wrote the proposal together, and early 2018, we received a special fund from the Dutch Postcode Lottery, which is called the Dream Fund. And the Postcode Lottery is the second largest philanthropist globally. And it's a new donor in this area, and we're quite proud that they are daring to invest in the sensitive topic of abortion. As we've seen in the animation, our program has an ambitious dream. It's a 4-year program, and we aim to achieve the outcome, the main results areas that you see listed here. 2.6 million unsafe abortions prevented, 8,000 maternal deaths reduced, and 160,000 unintended pregnancies prevented. And with DKT Women Care Global, who had just obtained the license at the time to distribute the IPAS MVA aspirator, and via our respective country offices and local partners and activities at country and global level, we aim to achieve these targets by 2021. The way we approach this is through a multi-component approach. Abortion is a sensitive issue, and I don't think I need to tell you that, and very few donors dare to invest in it. And organizations often work in fragmented pillars related to either the supply side, just the demand side, or the support side, focusing on advocacy. Our program is combining these components by implementing a multi-component approach, addressing the supply of safe abortion methods, looking at registration and distribution of medical abortion and MVA, creating demand for safe abortion at community level as well as individual level, by various interventions on information and education, attitudes, skills and behavior change, and individual empowerment. We also work on demand by advocating for supportive environments, looking at laws, policies, and guidelines at global, regional, national, and also subnational levels. Rutgers and DKT Women Care Global are working at the global level. In Ethiopia and Kenya, we are working through the DKT country offices and several in-country partners. And early next year, our program will also expand to 2 or 3 countries in Francophone West Africa. We're still designing that part of the program as we speak. So I promised to give you some update on Ethiopia, how we work, and some initial results there. In Ethiopia, we work through DKT Ethiopia office, Family Guidance Association of Ethiopia, that's the IPPF member association there, and Triggerize. Both DKT and FGAE are large organizations with national coverage, and they have been around for more than 40 years in country. Whereas Triggerize is a new partner, a very innovative partner with a young team. We work on product distribution, medical abortion, MVA, and also contraceptives, such as the oral contraceptive pill. We work on training of pharmacists and healthcare providers on the medical aspects of the products, but also on value and attitudes clarification, value clarification and attitudes transformation, VCAT. We also work on mass media and marketing campaigns, strengthening quality of care, and behavior change communication, for instance, by training and deploying peer educators in various circumstances. The program also has an mHealth component, but with the unreliable internet in Ethiopia, this is quite challenging. While mobile phone uptake and internet connectivity is slowly increasing in Ethiopia, we are working with Triggerize, who have low and no-tech solutions as well. And we're also looking at strengthening existing hotlines and SMS systems for referral. These are underutilized at the moment, and we really want to give that a boost to make it accessible for more women and young people in Ethiopia. In terms of advocacy, we initially set out to work on policy change in Ethiopia to allow lower skilled medical personnel to also use the manual vacuum aspirator, but our partners indicated that the current policy context is workable for them. They actually prefer not to push things too much at the national policy level, but rather focus on creating support for safe abortion at the local level. As you may know, Ethiopia has been a very closed country with an authoritarian regime for many decades, and it's only recently turning towards more democracy. A few months ago, civil society got more space in Ethiopia, allowing them to also undertake advocacy efforts. This program is monitoring the space for civil society in Ethiopia, and we are adapting to this changing context and will advocate for more space for safe abortion in the policy context in Ethiopia, but that is at the moment not our priority. So when we look at initial results in the country, after only 1 year of implementation, we can show some results already. DKT Ethiopia distributed more than 600 MVA kits and more than 30,000 medical abortion pills. They generated nearly 200,000 couple years protection, CYPs, from the distribution of the contraceptives. They also trained 637 pharmacists and providers on MA, MVA, and contraceptives. Family Guidance Association of Ethiopia focused on comprehensive abortion care and VCAT training, value clarification training, for their providers and other staff in their clinics in order to increase quality of care. And they reached 70 providers in the first few months of their interventions. DKT also developed and aired nearly 1,000 TV and radio ads on oral contraceptives pills, and with that they reached an estimated 12 million Ethiopians. Family Guidance Ethiopia reached more than 1,700 people by organizing various outreach events on reproductive health and safe abortion, reaching more than 700 students at universities and high schools, and more than 1,000 employees at plantations and garment factories in different cities and towns in Ethiopia. Another result is that DKT Ethiopia also updated their MA, their medical abortion counseling tool, and have developed and distributed several new consumer and provider-focused materials on medical abortion and MVA, like 6,000 copies of the poster you see on the right. It's a poster for providers on the MVA, the IPAS MVA Plus aspirator. As I said, in Ethiopia, we also work with Triggerize, and they have a rewards-based platform called Ticosystem. That you see a graph depicted on the left, and these platforms, they encourage behavior change by offering rewards, the so-called Tico miles, that members can spend at connected health facilities or retailers to get services or products for free or at a reduced price. The Ticosystem in Ethiopia provides referral to reproductive health and safe abortion services in connected clinics, and those clinics are connected to the Ticosystem, clinics from FGAE, DKT pharmacies, and other clinics. There are now 8 Ticosystems operational in Ethiopia, and in those systems there are 13 health facilities connected, 11 pharmacies, 71 diversified retailers, that includes shops and hair salons, but also a training and skills center where members can receive services or goods. Triggerize offers high, low, and no-tech solutions through different levels of mobile phones, and they collect real-time data on behavior. They also offer a rating system so that clients, young women that access services, can actually rate how they were serviced. And this in turn contributes to increasing the quality of care by the clinics. Currently, there are more than 869 mostly young people registered in the TICO system, and 98% of them, 794 individuals, were taking up services, and that includes 24 safe abortions provided. And on the picture on the right, you see a TICO member in the capital city of Addis Ababa, and she's spending her TICO miles at a small retail shop, and she's purchasing goods at a reduced price here, and they exchange the TICO miles by mobile phone. So that's one of the innovative systems that we've developed together with Triggerize. Now I turn to Kenya, and there we work with the DKT Kenya office, IPAS Africa Alliance, Well Told Story, and the Reproductive Health Network of Kenya, RHNK. Like in Ethiopia, we focus on distribution of medical abortion and the MVA aspirator. And this is again accompanied by different marketing campaigns with information on the products, targeting providers as well as consumers. Training of pharmacists and healthcare providers on the medical aspects and value clarification is again at the core of what we do in Kenya. Behavior change communication at various levels is also part of the program to address stigma and to provide information on the products, the services, and the availability. We also work at national and county level, that's subnational level, to do advocacy for access to safe abortion care and methods. And we also have a component on mHealth solutions to reach Kenyan women and especially young people who increasingly turn to the internet and their smartphones for questions and also for referral and advice. So some of you may know Kenya and the challenging context in Kenya over the past months, but I'm pleased to report that we managed to book some good results by and with our program partners. To list a few, DKT Kenya distributed close to 1,000 MVA kits and 55,000 medical abortion packs. And their various contraceptives generated more than 64,000 couple years protection. I must say that a pending shipment of 1,500 MVA kits is still on hold for pre-shipment inspection by the Kenyan authorities. And on the other hand, we face some delays by the Pharmacy and Poisons Board to approve different DKT brochures, leaflets, and posters to inform the providers and the pharmacists of the new products. But nevertheless, they managed to launch the MA Care brand, and DKT is undertaking marketing campaigns with their Lydia brand that are promoting IUDs as well as emergency contraception, amongst others. And they also focus on short-term contraception, such as condoms by the brand Kiss condoms. More than 1,600 pharmacists and providers were trained on MA, MVA, and contraceptives. And again, this was not just the medical training, but really focusing on value clarification and attitude transformation as well. Led by IPAS, there were community entry meetings in 2 counties, Kiambu and Kajiado County. And IPAS assessed their 62 facilities, of which 36 were selected for VCAT training. An initial 18 clinical providers were already trained on post-abortion family planning. And you may know that these standards and guidelines for the prevention of maternal morbidity and mortality from unsafe abortion were reinstated by Kenyan government this last June. So the momentum is now, and the program really seeks the opportunity now to roll out these guidelines and to train more providers on exactly what is the law saying and what are we allowed to do within the boundaries of the guideline. And for this, the program partnered with the Reproductive Health Network Kenya, who have been a technical partner to the Ministry of Health in the development of various guidelines around abortion. And RHNK is currently facilitating distribution of the post-abortion care guidelines and providing training to providers at county level. We also work through mHealth, and more than 12,500 young people were reached, including 7,780 youth via the IPAS Nimechanuka social media platforms that offer information and referral for safe abortion. And media partner Well Told Story reached 4,800 young Kenyans via social media live streaming at their Dr. Love platform. This is providing safe spaces for young people to discuss about love, relationships, and pregnancy dilemmas. And more than 1 million young Kenyans were reached via the Shuja's comic book that Well Told Story is developing, and they have printed a dedicated storyline on teenage pregnancies. So this is a sample of the Shuja's magazine that is produced by Well Told Story, and it's very popular in Kenya. Their reach is over 7 million young people aged between 15 to 24. And with the comic book, they reach about 750,000 young people per month directly. And their approach is to combine various media spaces, such as their comic book, radio shows, social media engagement, SMS services, and live events. And they do this to understand young people's experiences, their responses, the jargon they use, the slang, and also to address or to find out about stigma young people face around certain topics. And they do this really in a very young and understanding way without being patronizing. And that's the power of this this brand, Shujaz. Young people are engaging with fictional characters, and they also engage with each other. They share on ideas and provide support to each other. And they have in the background, there's a dedicated team at Well Told Story that is guiding and monitoring their discussions. The action research by Well Told Story is providing insights into sexual activity and perceptions about contraceptives amongst the different age groups of young people, which you see at the bottom. And these insights from the research help to shape messages and to provide advice to young people. Eventually, SMS and hotlines will follow up to inform young people where to go in case they choose to go for safe abortion, and or to guide them towards youth-friendly services. So that's another way we approach this to tackle the issue of unintended pregnancies, and eventually avoiding young girls to go for unsafe abortions by guiding them to quality care and services. This slide shows you an example of the CARE and the DKT Kenya branding for MA Care, medical abortion, on the left. And there's an advert for the Nimechanuka website managed by IPAS. And they have several social media features to connect and reach out to young people. Besides the website, there's Twitter, Facebook, and other platforms that they relate. And especially in Kenya, it's good to note that all partners are really working to come up with joint messaging and framing to address unintended pregnancies and to destigmatize abortion through the various channels they use, but with great care about the respective area of work of each partner, because they don't all, they're not all working in the same method. So just to inform you a little bit about the global work of the program, overall we work on 4 main pillars. We work on implementation in country, as I've just shared, communications, advocacy, and research. For communications, Rutgers is connecting all partners and components of the program, and we are turning evidence emerging from the program countries into content that can be shared with global partners and donors. Rutgers and DKT International are part of global and regional initiatives to advocate for the rights to choose, and we also advocate at various levels for supportive legal environments. For example, at the UNGAS or at the upcoming Nairobi summit. And in our communications as well as our advocacy, we focus on connecting the global to the local and vice versa. For example, during International Safe Abortion Day, to make sure partners are joining in that day, but also to feed experiences and stories from our partners to the global level. In terms of research, Rutgers is supporting partners to design and implement the research activities, and we are currently also looking at, we're also developing in-country qualitative research ourselves around stigma, positive deviance, and also maybe the role that traditional healers can play in prevention and referral. This is work in progress, as you will understand. As we have seen in the animation, one of our components is at the global level to make the manual vacuum aspirator available and affordable in more than 80 countries. This dream is being realized by DKT Women Care Global, and for that I would like to hand over to my colleague True at DKT Women Care Global. Thanks.
Thank you, Saskia, very much. I hope everyone can hear me. So thank you, Saskia, for that great presentation. And then, perfect, yeah, thank you. And thank you, everyone who is in attendance, for taking time out of your busy lives and schedules to hear what we have to say. So as Saskia said, this part of the presentation is more of a complement to what we've already covered and really looks at the global aspect of what we're doing under the She Makes Your Safe Choice program. And it's really about what we're doing with the IPAS MVA globally, and there are other aspects to what we're doing in terms of contraceptive, but I've chosen to focus mostly on the safe abortion side, given that is the main interest of the audience. Can we move to the next slide, please? Thank you. So a little bit about DKT Woman Care, just to provide some context. So I think the IPAS MVA has been around for years now, since the 1970s. And then it was formally incorporated under kind of a business, under Woman Care Global in 2009. And then Woman Care Global became part of DKT International in 2017. And so this new entity, which we're calling DKT Woman Care, is part of the DKT family, but it's a little different from a typical DKT country program like the ones that Saskia spoke about in Ethiopia and in Kenya. And the big differences in particular is that we're a manufacturer, and that brings a lot of responsibilities and a lot of opportunities with it that we'll speak about a little bit further in the presentation. But then it also means that we're working in both developed and developing markets. And the reason that I wanted to highlight that is because unsafe abortions aren't only happening in the developing world. There are lots of pockets, there are lots of, especially in countries that have high inequality, there are populations that get left behind, and so those populations are vulnerable. And so that's why for us it was important to also have a footprint and an impact in developed countries that are oftentimes left behind by donors or by people who are trying to do our kind of work. But in this slide, you can see the three different kinds of aspirators: the MVA Plus, the double valve, and the single valve. And the most popular one globally is that top one, the MVA Plus, which we sell in a number of countries. If we can move to the next slide, please. So for us, the big ideas for DKT Woman Care under this program were really around the 3 bullet points there. What can we do to increase registrations? So really, what does it take, or what can we do to make this technology available in more countries? And then the second part was, what can we do to enhance the local expertise? And we'll talk about this further, but it was really thinking about, what do we need to do to bring the product closer to the market? How can we use this technology that exists and understand what the local problems are to make this solution more applicable to the problems that women are encountering? And then the last point was around increasing the number of providers offering safe services. And this is really the idea that there are providers of all different levels, whether they are specialists, general practitioners, midwives, nurses, etc. And many of them are offering some type of abortion care now. But what can we do to move them from these less safe or least safe methods of abortion to a more safe method? And so really thinking about what can we move to kind of move along that spectrum? How can we move providers along a spectrum? Obviously, having some type of abortion care is better than none at all. But what can we do to move it in a direction where it's safer for women and provides better health outcomes? Of course, a big part of this program is promoting contraception, and that could be a whole nother presentation that we do. But for the sake of this conversation, we'll limit it to just the work around safe abortion. Next slide, please. Thank you. So this one is really looking at the registrations. And so this is roughly, this might be a little out of date by a month at most, but this is where we have our registration footprint today. So this is where the IPASS MVA is currently being distributed. And so you'll see that there is a very strong mix of developed and developing countries. I would just note that the blue countries, our registration is pending. I would just add a note that for India, it's actually the re-registration. And so we still have permission to sell the product while the re-registration is being processed. And that's just worth noting because India is a huge market. You know, a ton of people live there, and it's one of the most important markets for the IPASS MVA as well, given that it's used quite extensively in that country. But this has been a big part of our efforts over the past 2 years, over the past year and a half of the She Decides program, is really what do we need to do to get the product available in these countries. And so the last frontier, so to speak, is a lot of the Central and then Sahel countries in Africa. And in this regard, I would say what we're seeing is a little bit of, you know, the registration systems there are fractured to a certain extent. And so in some of the countries that are not colored in, we have not colored it in because we don't have an official registration. But in many cases, that still gives us the opportunity to import. And so it's not entirely accurate to say that there's no MVA in a country like Mali, which is blank on this map, but rather we would say that it's not registered and there's an unclear framework to register a medical device like the MVA. And so one of the other interesting parts about this map is kind of the indication that's used. And so in a lot of these countries, particularly where there's high opposition to abortion, or at least a lot of restrictions on abortion, we've pursued a strategy of registering the MVA for related services like miscarriage management. And so I'll speak a little bit further about that in terms of increasing the reach. But really, we've been focused on being pragmatic in order to find ways to get this technology into a country. And the same is true of medical abortion registrations, where we're looking at registrations for misoprostol as well. And in many cases, we register miso for indications that do not include abortion directly, but then we use advocacy in country after the fact to actually help increase the availability of safe abortion methods that way. So if we can move to the next slide, please. So here is about increasing local expertise. And I actually really like this map. This is courtesy of the Reproductive Rights, the Center for Reproductive Rights. And they have this interactive map on their website that's very interesting because it focuses on the laws. What is the actual policy surrounding abortion in a given country? And so it may not be that surprising that a lot of the countries that where we don't have a registration today are countries where it's extremely restrictive. And I think those two things are related. But on this point, this is where DKT Woman Care has really brought most of our value add, is that we work through distributors in country. So in a number of these countries, we're working directly with the DKT office, like in Ethiopia and in Kenya. But in countries where there is no DKT office, we work with a commercial entity, like a normal medical device distributor. And some of these people are doing, some of them just sell everything under the sun that you can find in a hospital, from bedpans and hospital beds to sutures to sterile gauze, etc. And they just happen to carry our product. But what we add to the equation is that we give them this knowledge and this expertise and this understanding of how to segment a market. And so we're asking questions of our distributors in all of these countries of how big, how many abortions are happening in your country? Where are they happening? Are they in rural areas? Are they in urban areas? How are they happening? Are they medical abortions? Are they surgical abortions? Are they clandestine? Are they maybe being mislabeled according to the statistics? In many countries that are restrictive of abortion, we find that a lot of abortions are actually being classed as miscarriages, or even as there have been some countries where extremely early cesarean sections are happening, and these are anecdotal stories, but extremely early cesarean deliveries are happening, and then they're being classed as miscarriages, and it's actually an abortion that's happening in a clinic. But other examples are around menstrual regulation and post-abortion care, because these are legal in many countries. Menstrual regulation is simply, it's where a woman is not having her menses, and then you provide a uterine evacuation to normalize her menses, to bring her period back. And this is generally performed up to 6 weeks. And the interesting point for me is that this is done without ever actually confirming a pregnancy. And so from that perspective, it's not actually regarded as an abortion. So in many ways, it could be conceived as an abortion by another name. But these little nuances or intricacies are important tools that we've been using with some of our customers to help make the same service more widely available than it would be otherwise. The same is true of post-abortion care, and especially miscarriage management. In a lot of countries, those services are available, whereas induced abortion is not. And so we see a little bit of expanding the scope of work by introducing our customers and the distributors in these countries, making them more aware of these types of services so that they can then talk about these services. And it's a way of reducing stigma that's related to abortion. We also, and this is the kind of work that social marketing organizations have been doing forever. So the DKTs, the MSIs, the PSIs, the IPPFs, they've always been active in this type of work. But it's not necessarily the function or something that the commercial sector has ever been terribly strong at. And so, given that DKT does not have a footprint in all of these countries, this is, the real value add from DKT is by being able to create a set of messaging and being able to create a narrative around abortion that really focuses on avoiding the unsafe abortion. Because what we've found is that even in countries where opposition to abortion is high, nobody supports unsafe abortion. Everybody is against unsafe abortion. And so that's a unifying factor. So we can get everybody on board to eradicate unsafe abortion. And then it's, the nuances in whether you eradicate unsafe abortion by converting them to safe abortions, or for people who are anti-choice, they have their own narrative around that. But we find that to be a unifying message that's enabled us to have conversations that we wouldn't have had otherwise. Can we move to the next slide, please? Saskia, yeah, thank you. And the last, nope, sorry, nope, perfect. And so this is the last point around how we're really focusing on converting unsafe abortions to safe abortions, is that we've emphasized increasing the reach of the MVA. So when we're in a country looking at the landscape, we are analyzing what types of abortions are happening, where are they being provided, what type of provider is delivering that abortion, is it safe, unsafe, or rather, is it more safe, less safe, least safe? So we look at those different criterias, and one of the big arguments that's useful for us is that in a lot of countries we still see D&Cs being performed, particularly I would say in a lot of middle markets. So countries like in Central Asia, in South America, we still see a lot of dilation and curettage. And these are less safe methods. It's a less safe method. And so we're seeing a lot of doctors who are using this antiquated method of uterine evacuation. And so for us, that's been a big area of emphasis, is converting those procedures to MVA procedures, because most of the characteristics are already there in terms of having a trained provider who is at least willing to provide the service, but it's just a matter of moving them to a method that is safer for the woman. And so we use arguments, like the ones that are available from WHO or from FIGO, the International Federation of Gynecologists and Obstetricians. They've issued guidelines preferring manual vacuum, any method of vacuum aspiration, whether manual or electric, and medical methods like abortion pills over outdated methods like D&C. And so this has been a third kind of prong of our communication strategy, is how do we move doctors away from these less safe methods towards safer methods. And this is the kind of education, the kind of work that we're doing with our customers in country, so that they're well armed with strong arguments, so that when they go and speak to the stakeholders in country, whether it's policymakers, whether it's the professional associations, or even just on their rounds with providers themselves, they're equipped with the kinds of details that they need to change minds. And Saskia, if you can move to the next slide, you may be asking, where does this actually get us? What does it actually mean? And so these are the sales by quarter of MVAs since DKT acquired, or since Woman Care became part of DKT in 2017. And you'll notice the numbers from 2017 through 2018 through 2019 are generally ticking up. And I circled Q2 2018 in kind of that reddish orangish circle, because that's when we formally began the She Makes Her Safe Choice program. And so from there, the numbers have been moving up quite strongly. And so we've been very excited by the results that we've been able to generate around the world. And note that these are our total sales. And so we really are looking at, the increase from one quarter to the next, and attributing that level of impact to the type of, the benefit that we're getting from this partnership with Rutgers and with the National Postcode Lottery. The other reason that we broke it out by quarter is because a lot of the MVA business, we work with a lot of governments, for example, on their procurement, which means that the MVA business is highly cyclical. And so that's why we see, typically Q4 is the strongest quarter of the year. And we certainly saw that last year. And one of the things that we're trying to do is actually to get away from that. We would rather level out the demand for the product because it's much easier for us to manage. And it also means if there's not large spikes in demand, that means that there's a steadier supply in country. So we're trying to work with more of our procuring agencies and with more of our partners to actually smooth out demand so it's so that we see steadier sales over time. So the next few slides are really just talking about our website. This has been a big part of what we wanted to do under the program. And this is, we're trying to bring the MVA business into the 21st century. And so the next slide shows on our website, we have now product information that we have not had before. And so there was never a centralized repository of information around the MVA. And so this is something that benefits certainly our customers, our distributor partners across the world, but then it also provides a central place for medical practitioners, healthcare providers to actually go to find authoritative evidence and authoritative data on the MVA. And so that's one element that we've been putting into place. A second exciting feature of our website is on the next slide. And this is really what we call our distributor map. So I just took a still frame here, but if you go onto our website, dktwomancare.org, there's a map under the how to buy section. There's a map, and you can click on any country in the world, and it shows who is the licensed distributor of the MVA. And so this had been a weak spot is that it was hard to find out who is actually responsible for this product. And so we wanted to use the power of technology to help alleviate some of that confusion that we were experiencing. For the future of DKT Woman Care, if we move to the next slide, so we're very excited about what remains under this program, because we're still putting into place some dramatic changes for our website, and particularly around how customers order. And so if we move to the next slide, this is just, this is where we're headed. This is the future of DKT Woman Care. So on our website, we'll have a distributor portal, which is where all of our customers can log in. And to make the analogy as simple as possible, we want our customers to be able to shop on our website as easily as you or I shop on Amazon. And so it'll be a password protected portal. And then, each user will have a user profile that is personalized, but it's associated within their organization. And so in many cases, we have procurement officers and then also finance people from the same organization. By being able to purchase products online, it'll make it easier for them to actually affect those orders. Next slide, please. So this is an example of once you log in, this is what you would see. And so on this page, we can actually upload documents. And so in international commerce, there's tons of paperwork involved, and that's been a sore point for us actually. Is that over the past 10 years, we've seen the medical device business become more regulated around the world. And part of this is just around the quality certifications, and then part of it's just around the nature of international import, export, and governments placing more duties and import taxes in place. And so having a centralized repository like this where people can share paperwork much more easily will, in essence, make our job a lot easier. If we can move to the next slide, please. And so, of course, our customers will be able to log into an order. And so this is the type of page that our customers would see. And so they would be able to, first they would select which country they're ordering to, and then that will bring up the pricing that they're eligible for, because we recently lowered our pricing for the FP 2020 countries. And so depending on which country the product is actually being shipped to, it will have an implication on the price that a customer pays. Next slide, please. Of course, like Amazon, you can see your purchase history. And so this is useful for customers. It makes it easier for them to simply buy the same thing that they bought last time, if that's what they want to do. But it also gives us a chance to analyze the purchasing habits. And so when we're talking about smoothing out orders, we'll use predictive data analytics. Over time, we'll see this person buys this many units, and then they reorder, over every 6 months or so. And so we'll be able to get to a consumption rate, some kind of a burn rate, and we'll be able to predict, ahead of time, we should be able to predict when will they place their next order. And that'll have big implications on the production side, but it also help us keep a closer track of what our customers are doing, and ultimately whether there are changes in the trends happening in a country regarding the provision of abortion. Next slide, please. And lastly, our distributor portal will carry we'll have what we call our resource library. And so this is basically a spot where we will have all of our marketing materials that we're making. We'll be able to put it up there for download, so we'll have high quality, high resolution files that our customers will be able to download and provide to a printer in country. And so this is something that will help us jumpstart the type of marketing support that customers need to be able to speak eloquently about the MVA in order to enhance the uptake in country. But what we've seen is that, for a product like this, the clinical data is extremely important. And so we'll also have, as part of our resource library, research papers. It's, the snapshot here is one provided by Bill Powell and Natalie Kapp of IPASS, which they published recently. But we'll have basically a collection of research pertaining to the MVA available for download online to help support the arguments and the type of research that our customers need to make. And lastly, we'll have things like product videos or training materials that our customers will be able to download should they so wish. So those are some of the things that we're very excited about. I think the next slide is just a blank slide, but we wanted to leave a little bit of time for questions. So I'll pass it back to Safia or Florence to move on. And thank you very much.
Thank you, True, and thank you, Saskia. This is Sophia for the great informative presentations. And now to Florence for a very brief question and answer section.
Thank you, Sophia, and thank you very much, Saskia and True, for this very, very comprehensive and interesting presentation. And so we only have 7 minutes for Q&A, but we will be, I think we could share the question to Saskia and True after the presentation, so they will be able to answer any question that will not be answered today. So the first question is from Kasahun Mormu Bedaso. I'm sorry for the pronunciation. So do the retailer provide medical abortion? So I guess that's for the, yeah, Saskia, if you can answer this question.
Yes, I can answer that. The retailers I spoke about are the retailers that are connected to the Triggerize, the TICO system in Ethiopia. And those are not the retailers who provide the medical abortion. They provide the products that will be offered to the members of the platform when they go for services. And the medical abortion is only provided in clinics by trained personnel or through pharmacies or other distributors trained and accompanied by DKT Ethiopia. So the retailers that I refer to are not providing the medical abortion.
This is true. I would just add that in Ethiopia, I think it's been deregulated down to mid-level providers, and so, you know, if you go to a pharmacy, I think you can buy it as long as you have a prescription. So there is interaction with an authorized medical provider is required, but just being able to buy it in a pharmacy does a lot for availability.
Okay, thank you very much. So I think you also answered the two other questions. How is the work of DKT Ethiopia and FGAE with the national efforts? And I think, yeah, that was the second question. I don't know if you see any difference. Saskia, yeah. Sorry.
This is true. Florence, I can speak to at least some of DKT's work, just being part of the same group. DKT Ethiopia works a lot with the government, and they actually align with the government on a lot of their policies. And so, you know, when we're building programs like this, we are always aware of what the government's directives are. And so, it's not the case that we go back and ask the government, you know, can we do this? Can we do that? But it's rather the fact that we know what their general frameworks are, and we know what kinds of objectives they're pushing towards, and we understand how objectives, you know, like safe abortion, Ethiopia has been very progressive on making safe abortion more available. And so we understand how our work under a program like this contributes to the national goals of the federal government.
Okay, good. I think there is no other question on the questions, but I will have two for Saskia concerning the attitude transformation in your module of training. Do you include the choice for the woman to choose the method of termination of pregnancy? Because I've seen in the countries we're working in, that's something that is never proposed to the woman, and I think that's something very important. And I think also provider must really provide comprehensive information to the woman on what's the benefit and what's the disadvantages of every method. So I wonder if that's included in the modules of your training, and which kind of modules are you using for the training? Is it modules that already exist, or have you done one specific for this program?
Yeah, thanks for that question. I can say in Kenya we work with IPES in Kenya. So that's the VCAT modules and training materials from IPES that we use, and that's constantly being fine-tuned and updated. And in there, I know the choice of method is definitely in there, because that's also the basis of our whole program, is the woman's right to choose. different methods and whether or not to have an abortion, and if she chooses to have an abortion, that it should be safe. And in Ethiopia, it's the VCAT materials from Family Guidance Association, and that is adapted from the IPPF VCAT materials, because FGAE is a member association of IPPF. So again, there it's really adapted to the national context in terms of what's available, what can be offered, and what are different, what's the different informations that are provided by different providers. But yeah, the choice of method is definitely in there. But I can check for more details. But of course, I don't know all the different training sessions by heart. But that's why we chose to work through local partners that are in country and well established with methods that have been proven to be effective.
Okay, thank you very much. And as I see that there is no other questions, I allow myself to ask through a question concerning Egypt, because in the safe abortion map, it is shown that it is prohibited altogether for safe abortion. But I think I've seen in the map for registration of MVA that you are registering it there. So I was just wondering, how do you work with the local NMRA for the registration, and how do you work in Egypt, if you have more information?
That's a great question, Florence, thank you. So in a country like Egypt, we will be able to register the IPASS MVA, but it would rather be for treatment of incomplete abortion. So for example, I don't know exactly what the guidelines are, but we'll be registering it for an indication to treat incomplete abortion or a miscarriage, basically. And so this has been a big tool that we've seen, is that in some countries, it's essentially the same procedure. Performing a uterine evacuation is essentially the same procedure, but there's a lot of legal technicalities that hinge on when and why are you providing that uterine evacuation. And so we've been using, in a lot of countries, post-abortion care, treatment of miscarriage or incomplete abortion is legal. And so we've been using that as a reason, or as the basis for registering the IPASS MVA in a lot of countries that are normally very strict on induced or voluntary abortion. But what we see is that by doing that, doctors are aware of how it works, and you have pro-choice doctors who understand what the product can be used for, and they understand that if a woman is presenting, they have an obligation to provide a service. And so it's a little bit of, DKT's never been terribly shy about pushing the boundaries on some things, but what we're trying to do is show to a lot of the policymakers that introducing this product is going to help reduce maternal mortalities. That's the first step, and then over time we hope to induce abortion. I hope it makes sense.
Yes, totally. Thank you very much for this clarification. I think it's really important, and we all work together with also PAC programs in order to enter in the country where abortion is restrictive. So thank you very much for this clarification. Yes. So I think the time is now over, and so I thank you again, Saskia and Drew, for this two great presentation, and Safia as well for the administrative support. And I hope you all enjoyed the webinar, and I wish you all a good day or evening.
Thank you for having us.
Bye-bye. Thank you.
Bye.
Thank you, everyone. Take care. Cheers.
Thank you.